Hello viewers, I am Dr. Huck. Part 1 of this presentation dealt with the mechanisms and stages of diabetic kidney disease. Now, if you have diabetic kidney disease, this session will help you understand what you can do to fix it. It's important to understand that the diabetes damage to kidneys occur over time and a number of stages, so that in the beginning the kidneys may work okay and you may have slightly increased pressure in the kidney, slightly increased filtration, and maybe some protein showing up in the urine. But as the stages go by, you start to see decrease in the ability of kidney to filter toxic material, and they start to accumulate. As this happens, usually the blood pressure becomes more difficult to treat, and when you enter stage 5 kidney disease, which is called end stage kidney disease, you may require dialysis because of that. So I just told you that the kidney disease from diabetes is largely preventable. So how is it preventable? What you need to do for that? Uh, you need to see your doctor regularly and have your hemoglobin A1C done every 3 months. And you should try and keep it under 6.5 to 7. Doing that will reduce the risk of kidney disease. Kidney damage from diabetes occurs because of high glucose levels causing damage to small blood vessels of the kidney, and you can prevent it. You can prevent that damage also by keeping the blood pressure under good control. Less than 130/85 is a goal, and your doctor will probably use ACE inhibitors or ARBs, angiotensin blockers, over other blood pressure medicines because they are uniquely beneficial for diabetes patients. Your doctor will check microalbumin in the urine and a blood creatinine level once a year. We discussed that in the first part of this talk. And if you have some kidney disease, your doctor will probably use these medicines called SGLT2 inhibitors like Jardiance or Farxiga. These agents are supposed to be extra protective for kidneys and should be used in high-risk patients. Your doctor will generally ask you to have low salt diet, and if the kidney disease becomes more significant, they may ask you to lower your protein and potassium um, in the food as well. And it's important to know that if you have some kidney disease, you are at risk for heart disease from diabetes, and therefore should be screened and evaluated for that. So what should be done to diabetes medications? Well, starting with metformin, which is the commonest medicine we use in patients with diabetes. Metformin does not cause kidney damage. That's important to understand that. But if you have kidney damage, then you may need to reduce the dose of metformin. And if the kidney damage is more severe, metformin should not be given because of a risk of lactic acidosis, a rare condition but serious condition. Uh, as we mentioned before, SGLT2 inhibitors are these new agents like Jardiance and Farxiga or Steglatro. These medicines are useful in reducing the rate of progression of kidney disease from diabetes. What about sulfonylureas like glyburide or glimepiride? These medicines are commonly used, but if you have kidney disease, it's better to avoid them if possible because they increase the risk of hypoglycemia or low blood glucose readings. Pioglitazone is another common medicine for diabetes, but its use in kidney problems can can make you more likely to have edema or swelling. Uh, and finally, GLP-1 analogs are these injections which are very popular for treatment of diabetes these days, including Ozempic and Trulicity and Victoza. These medicines are appropriate to use in patients with kidney disease unless the kidney disease is very advanced. In those cases, patients who are taking these injections may be at risk of developing more nausea or vomiting. And finally, insulin is the most is the safest medicine for diabetes to be used in patients who have significant kidney disease. The only issue is long-acting insulin preparations may require a decrease in dose because these patients are at risk of developing low blood glucose readings during nighttime. What are blood pressure medications? Well, as I said, if you have diabetes and some kidney disease, it's likely that you have blood pressure problem and quite often significant blood pressure problem. Your doctor will treat you with either ACE inhibitor or an ARB. ACE inhibitors are medications like lisinopril or ramipril. They end with a pril in their name. And the ARBs include losartan or valsartan or temisartan. These medicines end with a sartan at the end of their names, and that's how you recognize them. Multiple medications will quite often be needed in those who have kidney disease from diabetes. We monitor these patients' blood pressure laying down and standing up to make sure we're not over-treating them. And one medicine that has become available more recently is something called Kerendia or finerenone. Finerenone basically is a blocker of aldosterone, which has a direct positive impact in reducing the kidney disease progression. So, what about other medications? Well, patients with diabetes have to be careful with medicines in general. They may need to adjust the dose of medications if their kidney function is reduced. They may need to watch for drug-drug interaction. Example would be a statin with a fenofibrate. There may be a higher risk of muscle problems in those who take this combination, or statin with a calcium blocker can also be a problem. Generally, we ask our patients with diabetes to be careful with over-the-counter medications, particularly ibuprofen or Aleve, because they can make kidney functions worse and they make the blood pressure control more difficult as well. We ask our patients to be careful with herbs and hormones because of high risk of toxicity. And if our patients with kidney disease have a transplant, then the transplant medications may have interactions with cholesterol medicines and others, and you have to consult with your transplant team before you start any new medication. So what about diet? Patients who have diabetes and kidney disease, because they tend to have high blood pressure, they have to be careful about salt intake. We recommend low salt diet, and we ask patients to avoid items with high salt content. So in this table, the orange column has food items that are low in salt, fresh fruits and fresh meats and vegetables and popcorn, etc. And on the right side, the white column has things that you need to avoid, things that have high salt in them, including canned vegetables and soups, processed meat, seasonings such as teriyaki sauce or soy sauce, and salty snacks like chips and crackers or takeout food or pizza. These items should be eaten less often if you have diabetes and kidney disease. If the kidney disease is more significant, your doctor may ask you to avoid high potassium foods such as bananas, potatoes, tomatoes, spinach, raisins, etc. Low potassium food may be recommended in some patients, and the examples are shown in this diagram. One important thing to consider is that if you have significant kidney problems from diabetes, your doctor will ask you to watch out the protein and avoid high protein diets such as keto diets because they can make the kidney functions worse. So in conclusion, the kidney problems with diabetes are common and serious. They are usually related to blood glucose and blood pressure control. They are preventable, and early on they may be reversible. In later cases, they can at least be slowed down uh, from getting worse and from needing dialysis. Uh, Watch out for heart problems if you have kidney disease from diabetes, and be involved in your medical care so that you can understand the steps you have to take to keep diabetes uh, under control and diabetes kidney disease in check. This brings us to the end of presentation. I wish you good luck and goodbye. Please understand that all information in this presentation is for informational purpose only. It is not intended to be a substitute for professional medical advice. Always seek the advice of your physician or healthcare provider about questions regarding your medical or health condition. They have the best ability to give you advice that's most appropriate for your care. Thank you again.